Hello and welcome back to this program of Africa Wake Up. In today's episode, we're looking at environmental pollution in Nigeria, which is a major health pandemic. Please pay attention and think very deeply and tell me if I am wrong. Nigerian Health Minister Professor Isaac Folorunsho Adewale spent billions of dollars on importation of vaccination from America. I think it's daft for a Nigerian professor of gynecology and obstetrics and a former vice chancellor of the University of Ibadan and president of the African Organization for Research and Training in Cancer to spend a country life-changing whooping $2.8 billion on importation of vaccination instead of investing it in the health sectors across Nigeria to train and to support our local medical practitioners and better hospitals. Wow. Regardless of their education and exposure, this tells you all about African mentality. I have said it over and again. Changing government or politicians will certainly change nothing in Africa. It is a case of DNA. Otherwise, how can you explain that a professor in medicine and a health minister do not understand the potentials of investing in Nigerian health care services and has no clue if he was importing another form of Ebola virus? The Western medical experts are taking full advantage of these sycophants who oblige to the evil manipulation called epidemics, outbreaks, and pandemics. Someone has to tell them that the only way to confront the outbreaks or epidemics in the like of Ebola, monkeypox, yellow fever, cerebral spinal meningitis, cholera, etc., is to first of all invest in creating a clean and conducive environment and invest in Nigerian healthcare services. Secondly, allocate budget to Nigerian team of medical researchers. Pay well our local medical practitioners, doctors and nurses, building and equip good hospital. And again, when the government and the rich get sick and flown to the Western hospitals with an exaggerated price tag, they are still seen by and examined by the same African doctors working in the Western well-equipped hospital. So why can they not bring these medical practitioners back home and provide them with such working environment? Shame! Africa, wake up.
Music Studio.
Spending money in importation of vaccination is certainly not the answer to the African health system. The Nigerian health minister is not able to demonstrate the mitigation of this rising health crisis capable of damaging Nigerian health and economy. How can a country function properly without the Enforcement and Effective Management of Health and Safety Regulation Act? How can the country maintain good health with open sewages, gutters, infected puddles, slums, litters, human waste, dust and to say the least. How can the government explain those photos you've seen above? The main requirement for the management of health and safety regulation enables a country to implement, observe, and carry out risk assessment to eliminate or reduce risks of all sorts. Africa, wake up. What I'm saying is that we need a revolution. The problem of Africans are in our hands. Unless we change the way we approach things, things will never change. Guys, please, we'll have to, every hands on desk, we have to do all I can to change the status of Africa. We cannot earn respect by forcing people to recognize us. We must understand that we need to take the work back in our hands and understand the future of our life is in our hands. Let's go to work, everyone. All hands on desk. Let's make Africa a better place. It's never enough time to talk about the issues of Africa. But we will continue in the next episode with a different topic. Thank you for watching. Subscribe, like, and share. We appreciate every one of you that have subscribed, that have liked, that have commented on our videos, and have shared. We'll keep doing our work. Thanks a lot, and have a very good day. Bless you all.